all cancers are not life-threatening, and you should not start thinking in that way. There is a lot of advancement, you can say, in the medical world, or in the medical, there are a lot of scopes. So things can turn out well.
Welcome to Stories of Courage, a podcast series by Max Healthcare. Along with expert medical care, a patient's courage and resilient spirit play a critical role in overcoming a difficult disease. आइए इस पॉडकास्ट में सुने कुछ ऐसी ही करेज की स्टोरीज.
Hello. In this series of podcasts on Stories of Courage by Max Healthcare, we bring to you yet another interesting and powerful story of severe perseverance, grit, and determination by a young woman, Mrs. Kanchan Bala. Hello, I am Dr. Swasti, Principal Consultant in Gynae Surgical Oncology at Max Institute of Cancer Care, Vaishali. Kanchan is here with us today. Kanchan, would you like to introduce yourself?
Thank you, ma'am. My name is Kanchan. I'm 33-year-old. I'm residing in Noida. By profession, I'm an IT engineer. And by heart, you can say I'm more like a home cook, or sometimes I paint also. Those are my hobbies. So basically, I'm married since 5.5 years. And me and my husband, we both wanted to start family since last 2 years. But somehow we were not able to conceive. We tried a lot of things, like we have done a lot of tests and all. And I was diagnosed with a small fibroid, and I ignored it like other ladies do. And I had like little bit symptoms also, but I never thought like it could result to any major problem in future. And one day when I found like this is one of the issue, or the major issue, and somehow diagnosed with first level of carcinoma, then someone referred me to Swasti man, and further we met in the Max Vaishali Hospital, and that's how these things started.
So, Kanchan, did you, what did you actually feel when you were told that you have a uterine cancer or an endometrial cancer, and how easy or difficult was it for you to sort of absorb that news, and how could you cope up with that diagnosis?
First of all, hearing a word cancer itself, like first time for anyone like who is living a normal life, and never thought like something can happen, never heard in my family also. So definitely it was kind of very shocking for me, and I don't know how to react on that part. I don't know. I mean, sometimes still I think about that 4 months ago. I feel like those chilling vibes, like, why it happened suddenly, and I cried so much. I was not even sure. And my gynae, who I was referring earlier, she was not able to tell me because she knew that how fragile I was. And she was talking to my husband continuously. And then I was thinking, like, I started thinking a lot. And like other normal people, what is the first thing we do in these days, right? We start Googling things, and we go into that, like, okay, these are the symptoms, this is how I ignored, and that's how it lead to this problem. So it's very normal. And I think internet is a major problem then, because sometimes we just listen, or we just read few things and start looking without any consulting with the doctor. We started looking things at our own, and I did the same thing. And there were like a lot of emotions going on within me. A few of them were like, I was not more worried like I was diagnosed with the cancer, but I was more worried about my family, and especially Rishabh, my husband, because I was thinking like there are like little bit expectations from me, and I could not fulfill that. Everyone wants to be at their best when they are with their in-laws, and all, basically when they are so supportive, and I'm not able to do something for them. So it was like more like an emotional shock for me than a physical one, because I never so much worried like how I will overcome about this, or what could be the major thing, or I have to go through the treatment and all. I was not even worried about it. I was more like, can I have the baby or not? I mean, continuously I was asking the same question to my gynae, and she said like, you don't need to worry about it. You need to go to the proper care, or with the proper consultation with the doctor, and things can change. Like she gave me like so many stories and all, and she gave me one motivation also, and that actually changed my life. She said, like, when you came to this world, if something happened with you, then don't think like it happened, without any reason. There is a reason behind it. Maybe you can impact other people with your story. And she gave me her example as well. I mean, there were a few things happened with her. So I'm thankful to that, and I started thinking in a positive way. And then I met with you, and that how was our first day. Like, I came here with my mother-in-law and my husband, and I cried so much. I tried to hold those tears behind my mask because I was wearing it. But yeah, it was not that good. But yeah, I mean, that day was not good. But yes, then we planned things like you have explained each and everything, like how it will take. So the first time when you explained me, like, this is this much time it will take to recover things, 3 months, and then we have to do the hysteroscopy again, then we have to go all the procedures again. So I was like little bit worried, like not thinking about that 3 months I can recover. I was not thinking about that. I was thinking like how it will go for another year. Not positive on the very first day about those 3 months, and maybe I can recover. But I was not thinking in that way. I was thinking like maybe it will take another year. So yeah, I mean, those were like negative emotions, I would say. Yeah, I mean, that was like the first day experience at Max.
And how supportive, of course, Rishabh was supportive, and how supportive were your in-laws and your other extended family members, beyond your household?
Right. So here I live with my in-laws, and my family, they are residing in Himachal. So I'm basically from Himachal.
Okay.
So, and since my father and mother, I met them mostly twice in a year. So I don't want to give them any tension, although they knew that there is some problem going on. But at this level, they were not very aware. And by any chance, like coincidentally, you can say, my younger brother, he's only 2.5 years younger than me, but he was here only. And he was residing with us at that time. So he got to know, other than Rishabh and my family, he was the first person who got to know things. And we have very special bond. Like he always treat me, I mean, we are friends, but definitely he treats me like a mother figure always. So he was also very worried and not able to tell me directly. Okay, he was also in so much tension and all, but he was like consoling me. Okay, everything will happen fine. And I had like lot of anxiety issues when I got to know things. Actually, one day I'll tell you one scenario. We were celebrating Christmas, and it was all on a Zoom with the office team members. So everything was going fine, and my report went for the second time for the checkup. I mean, they want to do the second time
slide reviews.
Slide reviews. So what happened? Like around 6 p.m. we wrapped up that Zoom call, and I was talking to my manager and my other colleagues, the management people, and we were very happy. And suddenly that report came online, and it was confirmed that time, like a grade 2 level of carcinoma. I don't know what happened. Within 15 minutes, I started puking and lot of pain in my tummy. I was thinking like it never pained in that level. I could not
you
even
called me also at that time.
Yeah, I could not walk. I could not sleep. I could not sit even. It was so painful moment, and I had few medicines also. Even the medicines were not going inside. Even I started puking continuously.
What were you thinking at that time?
I don't like it. Was completely, I think, anxiety which took over that happiness suddenly. And even I don't believe like I could be in that extent. I could think in that way. So somehow it was running in my behind, but I was not showing, and I was get along with the other people and all, but it was in my mind somewhere. So that is the reason I think it happened. And then I admitted to hospital. They gave me some injections and all, and then I recovered. Then we met again. I think yes. I told you this thing also. And then you said like you start doing some meditation and do some yoga. Maybe that can relax your mind. And I remember you gave me some medicines also to, which can help me to calm down my anxiety. You were not
sleeping well, if I remember.
Yeah, that time. Well. And because I was thinking too much, to be very frank. So yeah, that was one of the reasons. Then I joined some workshops for the meditation and the yoga. And I think since January 2nd, I joined that program, and I was continuously doing that.
And that helped?
Yeah, a lot.
So do you think doing yoga and improving your lifestyle helped you cope up with the distress that the diagnosis of cancer
Yes, other than medication, definitely this will help you. This will calm your. Actually, this is not for your physical health, but your mental health, because that can calm yourself, and you can work more on other things, other than thinking continuously like how the therapy is responding on me. Other than that, you can just focus on your body also, because you know that, right? Being a IT person, it's sometimes it's very lethargic. Like you don't want to do anything. You keep sitting in front of laptop for 10 or 11 hours. You're not even working. Other than doing some core of work at my home, like cooking and all, I was not doing any major work. So because we have like housemates and all, right? So we are not doing anything. So when I initially joined that yoga, even my body was not responding very well. And it was like a proper session. You have to take shower in the morning and all, which I never did. But then I made a habit, and I thought like, okay, this body is not just for enjoying the world, or just to just to see things and all. You have to take care of your health. You are the one responsible for that, and you are the one for doing other things also, for your family also. You need to take yourself, then only I can take care of my loved ones, right?
Absolutely.
So this was the thing, and I continued with that. It really helped me, and I will surely say to everyone, at least to have one hobby. Not if you're not that much yoga person, but at least make something, maybe a daily walk or something. I think that is very important.
And I heard something about painting. Kanchan loves to paint.
Yes, so that is my another hobby, and you can say like I love to do art and craft. I have my page also, so I do post there as well.
So you have a Facebook page?
Yes,
which we could follow?
Yeah, definitely.
And
maybe I'll get some subscribers and some followers.
I love that painting of yours where you painted the mother and the real emotion behind it. You would love to talk about that, Kanchan?
Yes, definitely. So I recently started the Gentangle art. That is one of the art form, and I love learning other art forms as well. But that one of the art form, because it's very easy. Even if you are on the office meetings, right, you can start doing something with the pen.
I hope your boss is not watching.
Yeah, definitely. But when I do post, they are asking me, when are you getting time for all these things? So yes, I, because of I am 33, and most of my friends, they are married, and they keep posting all the pictures of either their babies or they are about to become parents and all those things. So I wouldn't say that I feel jealous, but yeah, there is a moment it come like, why I'm not. So yeah, that is one of the thought process going on, and I made that Gentangle. I don't know, like whenever earlier also, before this problem, like it happens like every month you wait, okay, this month maybe I'm pregnant, this month maybe I'm pregnant. So that feeling, I think that led to somewhere to put those emotions on the paper. So yeah, I think that was one of the things.
Yeah. About the feelings that you had when you had your first biopsy report. What were your feelings when you got your second biopsy report, which said that you were cured of cancer?
Right. So that was also actually very amazing, because I never that much hopeful, because it's like when your result is about to come, maybe you can pass or you can fail, something like that, right? So that feeling was there, but somewhere I had a hope that maybe I'll be overcoming these things within 3 months, but and 1% you are not very sure, right? So when the report came, and I was so happy, I thought like, okay, at least one step is done. Now we need to move next, as you recommended, like this therapy will preserve the uterus thing, and then we can plan the pregnancy. And then yes, we opted for the another option that you have recommended. I think so far things are happening in that way. Let's see like how it will.
I just pray and hope that we will see you with a baby in your hand very soon, Kanchan. And how difficult was it for you to from Himachal, this journey to Delhi NCR, being an IT professional, coping up with cancer? And now your journey ahead, what are your plans for your future?
So, so far, my journey was very different, other than the other, I would say, Himachali girls of my age, or you can say the other family members, the family girls, you can say, because I was the first one who planned to move down from Himachal and doing engineering, such a step. And my father supported a lot. He was in army. So I did my engineering from Pune, and then they don't want me to work, to that far. So they said like, why don't you plan to work in Delhi? So after my graduation, I moved to Delhi, and I searched here a job, and I got it. So since 2011, I'm staying in Delhi now. It's been like more than 13 years. And you won't believe, like, Delhi was the last place I would thought at that time, 2010, that I will live, because there were like so many things here, and I never thought like I'll be able to. One of the major factor was the summer. So it's very difficult for me at that time to live in the summer, because I gave some of the, you can say, prelims exams in Delhi during after my 12th, and it was too hot in May and June. So I never thought like I'll be able to stay, but I never thought like I'll be staying in future like permanently in Delhi. And then it's been like almost now, I think this August we'll complete 6 years with our marriage. So I moved to Noida, and now it's a home for me. So things are pretty fine, and never thought like I'll be having these many things like up and downs. I thought like journey would be very smooth for us. Maybe after 2 or 3 years I'll have babies and all. I mean, I planned in that way only, but somehow things didn't turn in that way. So, but yes, I think I have a good support from my family, from my in-laws, my husband, who's very, very supportive for anything. And I think with your family, friends, I have very good friend, my childhood friend. She also supported me a lot. She recently had the baby in month of January. So even she told me like, if you can't have a baby, I'll have another baby for you. Don't worry about it. Just take care of your health. So I think those are, even no one is doing anything for you, but those words makes a huge difference. I remember before our hysteroscopy last, right? We had a discussion and we laughed so much for 20 or 30 minutes. I continuously laughed. The whole thing turned into a laughter. So when I reached home, no, I was thinking, I was doing the analysis on that. But like the first day I cried so much when I met you. And the day before the hysteroscopy, I laughed so much. So how different both the days, right? So it all depends on the time. Like people are not good or bad, or it all about the time, or the the present moment, how it was going, right? So things may turn out good if you have a positive thinking, if you have a support from your family, if you have a good friends. I think those are the factors that can
सो
help.
कंचन, मैंने जब तुम्हें सबसे पहली बार ये बताया कि हमें एंडोमेट्रियल या यूट्राइन कैंसर्स में फर्टिलिटी प्रिजर्वेशन भी कर सकते हैं, और मैं कुछ टेस्ट्स करूँगी और हम देखेंगे कि क्या हम आपके यूट्रस को सेव कर सकते हैं, बचा सकते हैं, तो तब आपके मन में क्या आया कि क्या करना चाहिए? बचाना चाहिए, नहीं बचाना चाहिए, क्या यूट्रस निकाल देना चाहिए, क्या जीना ज़्यादा ज़रूरी है? मैं आपका पर्सपेक्टिव जानना चाहती हूँ.
फॉर मी, जैसे मैंने पहले भी कहा आपसे कि बेबी वॉज द फर्स्ट थिंग फॉर मी. सो जब आपने बताया कि वी कैन प्रिजर्व द यूट्रस ऑल्सो, आई वॉज thinking too much about it, because I never heard about this treatment and all. I was thinking like maybe after this problem, हो सकता है मैं कभी भी कंसीव ना कर पाऊँ. ये भी, दिस इज़ वन ऑफ द पॉसिबिलिटी, राइट? यू हैव टू मेक योर सेल्फ रेडी फॉर एवरीथिंग. सो रिमूविंग यूट्रस, इफ़ यू आर आस्किंग मी, उसके लिए तो मुझे अभी भी थोड़ा सा टेंशन होता है. मे बी आफ्टर हैविंग माई बेबी ऑल्सो, मे बी आई लिटिल बिट वरीड अबाउट इट. बट दैट टाइम आई वॉज नॉट वेरी श्योर how it will happen. But when things gradually comes into my favor, I think the one thing I learned from this journey is like all cancers are not life threatening, and you should not start thinking in that way. There is a lot of advancement, you can say, in the medical world, or in the medical, there are a lot of scopes. So things can turn out well if you plan it properly, if you have a good doctor, if you have a good consultation, and they can turn into your favor. So I think they resulted good for me as so far.
So what's your take home message? जो आज महिलाएं इसको देख रही हैं, कहीं ना कहीं उनके लिए क्या एक संदेश है कंचन जो आप देना चाहेंगी आज?
मैं यही बोलना चाहती हूँ कि लाइफ में ना हर चीज़ ऐसा नहीं है कि कोई प्रॉब्लम है या कोई बीमारी है स्पेशली. सो जैसे कि हमारे दिमाग में सबसे पहले आई सेड लाइक वी स्टार्ट थिंकिंग एंड वी स्टार्ट सर्चिंग आवर सेल्फ in terms of treatment, and sometimes we ignore the symptoms also, like I did a lot. I think that is the reason this resulted in last 2 years. I had these symptoms like last 2 years, but I never thought like to go to doctor, or just taking care of myself, or taking some home remedies, going here and there. सो मुझे लगता है कि whenever you are getting some symptoms and you think like and you have like such an important step to take care in your life, like you want to plan family, right? Don't delay things. And if you think like there you have some PCOS or PCOD problem, especially this is also one of the PCOD issue,
बहुत common
very
problem.
common issue. So मैं तो यही बोलना चाहती हूँ कि when you get to know, go and visit your doctor, get a proper consultation. Don't make choices at yourself, because you are not doctor, you don't know, like right? And just don't go by some advice with the elders and all. I think proper consultation is very important, then only you can diagnose things properly. So मैं तो यही बोलती हूँ कि don't delay things like me because मुझे लगता है मैंने थोड़ा delay किया है, maybe things would be other.
तो ये बहुत ही इम्पोर्टेंट मैसेज है कंचन आपका सभी के लिए कि हमेशा अपनी सेहत का, अपने सिम्टम्स का ध्यान रखना चाहिए। अगर कुछ है तो जल्दी ही इलाज या जल्दी ही चिकित्सक परामर्श लेना चाहिए। वी हैव टू टेक अ एक्सपर्ट मेडिकल कंसल्टेशन। यंग लोगों में भी कैंसर हो सकता है और उसको इग्नोर नहीं करना चाहिए, एंड कैंसर इज़ नॉट द एंड ऑफ लाइफ। थैंक यू सो मच कंचन फॉर बीइंग हियर एंड in Stories of Courage. We've loved to hear your story and I hope you continue to inspire many other young women like this. तो आज आपने देखा Stories of Courage by Max Healthcare में मिसेस कंचन बाला को, जिन्होंने अपनी ग्रिट, अपनी डिटर्मिनेशन, अपने परसिवरेंस के साथ एक नया आयाम कायम किया है। एक हिमाचली लड़की जिसने गांव से निकल के शहर में प्रवेश किया, इंजीनियरिंग की तालीम हासिल की, 33 साल की उम्र पे उसने कैंसर, यूट्राइन कैंसर, बच्चेदानी के कैंसर को हराया और आज वो निकल पड़ी है माँ बनने के लिए। मुझे और हमारे सारे मैक्स हेल्थ केयर टीम की तरफ से हम कंचन को पूरी शुभकामनाएं देते हैं। हम चाहते हैं कि जल्दी ही ईश्वर उनकी गोद हरी भरी करे, उनको एक बहुत ही प्यारा और स्वस्थ बालक या बालिका दे।